Align the shoulder with your wrist, the hip above the knees. The knees are pelvis width and the hands are shoulder width. Let your gaze fall about 45-degree angle on the floor. Now we start to tilt the pelvis. Slowly anterior tilt the pelvis and posterior tilt. So you can feel the front part of your pelvis dropping down to the floor. And when you round your back, it's tilting backward. Start with big range. Try to have even range of motion on both sides. Focus more on the pelvis rather than the whole spine movement. And slowly lessen the range of motion. Make the movement smaller. And slowly stop in the middle. Notice how your muscle work to maintain this position, to maintain your neutral spine. What's the difference compared to when you first come into all-4 position? Let your body remember, and then slowly sit back on your heels. Feet apart wider than your pelvis. Bring your hands on top of your pelvis. You can feel a bone there at the front. We're going to do anterior tilt and posterior tilt. When you're ready, slowly move the same way as you move in all-4 position. Start with bigger range of motion and then slowly lessen the movement. Once you're ready, stop in the middle and release your hand on your thighs. Relax your shoulders. Let your shoulder blades soften down. Relax. If you push your ribs out to relax your shoulders, bring it back. Simply feel how your ribs stick on top of your pelvis. And your chin is parallel to the floor. And imagine there's a line pulling up on top of your head. Now we're trying standing. Separate your feet apart about pelvis width. Slightly soften your knees, put your hands on the pelvis. We start to tilt the pelvis anteriorly and posteriorly. Try to make even range of motion. Start with bigger movement and slowly make it smaller. And then stop in the middle when you are ready. Release your hand, soften your shoulder, let the chest open naturally. Chin parallel to the floor, and stand up tall. Observe how your body works, how the muscles work to support this neutral spine position.